Hello, my name is Angelina Savarese, and this is Module 3, and I chose to do the sternoclavicular joint. So the sternoclavicular joint is right here. You can palpate it on the left and the right side. And this is an image of it. The articulating surfaces include the sternal end of the clavicle, which is slightly convex, and the clavicular notch of the manubrium of the sternum, which is slightly concave, which makes it a good fit as a joint. It has articular disc right here and the 4 ligaments that keep it stable and allow for slight movements. These 4 ligaments, which are pictured here, except for the posterior sternoclavicular ligament, we have first the anterior sternoclavicular ligament, which keeps the clavicle from moving too posteriorly. On the posterior side, we would have the posterior sternoclavicular ligament, which keeps the clavicle from moving too anteriorly. And then we have stabilizing ligaments like the interclavicular ligament and the costoclavicular ligament that stabilize the joints. And then we have a joint capsule, which involves the ligaments covering and stabilizing the joints with the articular disc inside between the articulating surfaces. This is anatomically a saddle joint, which is usually a biaxial, but because of this articular disc, it is functionally classified as a multiaxial joint. And the movements of this joint include elevation, which is shrugging, which would be shrugging the shoulders. So the clavicle is moving superior, and then bringing the shoulders down to the neutral position where the clavicle would be depressed, moving slightly inferior. And this is done on the frontal plane on the Z axis. And then we also have protraction, which would be protecting somebody like a hug. And you could feel the clavicle move slightly anteriorly. And then we have retraction, which would be like if you're disgusted by somebody and you're retracting from them, and that you would feel the clavicle moving posteriorly, and that is done on the transverse plane on the y-axis. And then because of this articular disc, we are allowed to have slight posterior rotation, which is done by flexing the arm, and you can feel the clavicle rotating posteriorly ever so slightly. Thank you. And it's done on the sagittal plane. Thank you.